Hi, my name is Matea. I'm 33 years old, and in July 2019, I was diagnosed with acute lymphoblastic leukemia for a second time. Actually, it relapsed after 17 years. When I was first treated for my first leukemia, I was treated only with chemotherapy, and this time a stem cell transplantation from an unrelated donor from 10 match was advised as the best option to achieve long-term remission. So in February 2020, I received stem cell transplant after 6 cycles of intense chemotherapy. I spent 51 days in hospital, and within the first 42 days after the transplantation, I experienced multiple serious complications. On the day 11 after transplantation, I developed first a rash all over my body. Plus, I was diagnosed with a grade 3 acute skin GvHD. And I was also diagnosed with the grade 3 acute liver GvHD after an increase of my liver enzymes. So my GGT and my bilirubin were going really in the skies, and that was in a day plus 23. As I said, in the first 42 days after my transplantation, I experienced multiple complications such as menstrual bleeding and abdominal pain. So I was also getting transfusion and bleeding at the same time. I got a rash all over my body. Got pneumonia and really high temperature, influenza type B, and muscle weakness. And at that time, my life felt like everything was falling apart because it was just going day by day. It was always something new. So it was also the time when COVID-19 started. So that meant no visitor were allowed to go in the hospital or see me, leading to feelings of powerless, loneliness, and fear. About my GvHD treatment journey for my skin, I've got local steroids and corticosteroids cream. It was prescribed to relieve skin symptoms such as itching, burning, and I can't even describe how does it feel because it's not like mosquito bite. It's like your whole body is. You just want to rip your skin off yourself because it's really terrible. And that's the I can make um when you have skin GvHD and liver GvHD, you feel skin GvHD, and liver GvHD is something that you cannot feel. You can just see yourself getting more yellow from day by day. And my liver enzymes were going wild. And I remember that in one point, my GGT was over 600, my ALT was over 800, my ALP was over 300, and AST over 700. So in day 28 post transplantation, my symptoms progressed, therefore, ruxolitinib was prescribed. On the day 35, they recommended ACP as a conventional therapy. Therapies were not completely controlling my symptoms. So, of course, I had some concerns regarding my ACP therapy. First, will this therapy help? Because I didn't know anything about that because I was just a patient. And I'm the kind of person that really, really likes to know and loves to know anything that's happening, whether that therapy is going to work, will it help, how long will it take, and in the same time, I was scared, but I was excited because I really hoped it will help. And of course, the first thing they told me, if you're going to ACP, you need to have strong veins. And since had a port catheter implanted from the beginning of my chemotherapy, my veins in my arms were not so damaged and I was suitable. I was also advised to exercise every day with that little squishy ball. So my veins were strengthened. About my experience with ECP therapy. So the first few sessions were when I was still hospitalized, and they were longer. They were taking about 4 hours. But once faster machine was approved, sessions reduced to 3 hours. On the 42nd day after my transplantation, I was discharged from hospital, finally, with 14 medications, including ACP. And that meant that I needed to travel every second day 60 kilometers from my parents' home to Zagreb, which was really exhausting and required careful planning because it was during COVID-19 and everyone was isolated, and also had my own isolation. So during ICP therapy, any activities were challenging due to weakness and tiredness. Also, I was, as I said, isolated alone due to COVID, and I had limited freedom. I didn't see anyone, any friends, family, only my mom and my stepdad and stepsister. At the same time, I also developed BK cystitis, aiding the emotional and physical strain, and I was really in extreme pain. I was wearing diapers and I experienced high blood pressure and confusion and hallucination. And at that time, I remember that I called my husband and my doctor and I said, I can't do this anymore. Like, this is the end of everything. It's taking too much. It's taking too long. I'm not going to make it. But, I have a child. He was 2 years old at the time. He's now 8.5, big boy. And I needed to stay focused on recovery and rely on support of my family and stay motivated. And of course, I also regularly interacted with my Dr. Zinaida Peric and my ECP team, who were caring for me and coordinating um, my treatments. And really, their empathy and their clear communication helped me the most. For some advice for GvHD care teams is to have clear communications, guidance, and detailed explanation on what patients can expect of the treatment and of the huge impact of the GvHD health and lifestyle. Because being informed about treatment and about decisions and understanding the processes that you're going through actually provide a sense of control and reassurance during a time when so much felt uncertain. Of course, you need to support patients emotionally and acknowledge importance of quality of life. I remember that's my favorite memory from ACP. I always came first to the hospital because it was empty. It was pandemic, and I wanted to be first inside so I can go first back home. And it was my birthday, and they didn't let me in. And I was just like, why am I waiting outside with people, other people? And I know that I'm fragile and I can get any disease if they sneeze. And when they called me inside, they put balloons on my bed and they bought me a little muffin and I had candle. They sing me happy birthday, and it was, I really felt like they see me as a human being. I'm not just a number. They see me. They value me. They hear me, and they're here for me, really, to help me. And that was amazing feeling. So I was aware of GvHD in general, but I really wasn't fully informed of how serious of life threatening it could become, or how much it could affect daily life if it becomes or turned chronic. It would have been helpful to have more detailed explanations and guidance on what to expect. And so patients like me, who wants to know everything, could be better emotionally prepared for challenges ahead. And of course, you need to encourage patients, provide reassurance, help patients find strength in small victories, small steps, empower them to navigate the difficult GvHD journey with hope. For advice for patients with GvHD, well, it's hard to give some advices, smart advice. You need to be really, really patient because and trust the process because ACP is really silent, is long lasting, is draining, and is exhausting. But it keeps your life moving forward little step by little step, and every small improvement counts, and you are actually stronger than you think. Of course, you need to talk openly with your doctors. You can always ask them, they will listen, they will explain clearly, and it will become easier to manage your concerns, and you will feel valued, heard, and respected. And you can always rely on your support network and connect with other patients. There are I am now aware that there are hundreds or thousands of people that had or have still have same condition like I did, and we people need to connect, and because it's easier when you know that someone is going through the same or similar thing that you went through or are still going, so you are not alone. There are also a lot of groups and a lot of uh, I don't know, Facebook sites or WhatsApp groups, and that there are patients that have those same disease. So we do have no GvHD site, no acute lymphoblastic leukemia, WhatsApp groups, Facebook groups, and so on. And we are connected and we support each other. So at the end, think I need to say that patience and allowing time to heal is really, really important. However, quality of life after leukemia and GvHD will never, ever be the same. I think I know that because it's my second time. So, for example, I have actually two total endoprotheses of my both hips due to corticosteroids and because of high dosage of corticosteroids. So I have osteonecrosis I had of hips and from my knees. Quality of life after leukemia and after transplantation and after GvHD must include mental health. Those are invisible conditions such as depression and PTSD often go unnoticed even when everything on the outside seems fine. Life after transplantation is not about just staying alive. It's also about finding strength and believing that joy is possible. And for example, most of my days are filled with constant worry, constant overthinking, and feeling that this is not who I am or who I want to be or who I was. I'm really still trying to find myself after 6 years. People may see survival, but they do not always see the quiet struggle of learning actually how to live again. So true recovery means giving ourselves permission to be angry, to be sad, to be broken, to scream, to shout. But at the same time, you need to allow yourself to feel happiness, to find happiness in small things like being outside because you were closed in a sterile room with the glass. And you need to accept love and support that is always around you and to reclaim the life that was nearly taken and that is deeply undeniably deserved. Thank you.
What I'd like to ask is, is we have very positive experience also with patients who are feel very well supported by the ECP team, but especially from the US, we frequently hear, but ECP is so cumbersome for patients. They need to travel a long time, so they'd rather go with drug therapies. You were unfortunate that this all also happens during COVID. But would you, as a person who went through it, say it's uncomfortable?
ACP.
Yeah.
It's not uncomfortable. It's uh, it just takes a lot of time, but it's like going through dialysis. You just need 2 hours and lie down and wait for hours. So it's you are drained after that, but you're already drained from everything that you experience. So it just goes one on the others. It's not hard to go through ACP.